Thank you so much. It's so great to see you, and thanks for accepting my invitation to be on my humble channel. It was even more humble when you accepted it months ago. I'm
I'm
good.
happy. I'm happy to do it. I'm excited that there are people interested in Turkey. That's awesome.
Yes, very much so. I already made an extensive video on your book, and it was very popular on my channel. I
Cool.
do social sciences contents exclusively, so also like psychiatry is kind of in that area that I talk about. So people were very, very interested,
Okay.
and I'm so happy. It's such a big deal for us, the whole community, that you accepted this
Oh, thank
invitation.
you.
We've been waiting for months. I have as
Oh,
well
that's so
personally.
nice. Thank you. Delighted.
What brought me to your book, Dopamine Nation? It was very popular in Turkey as well, but it took the US by a storm. Was a psychiatrist, family friend, Ayhan Kalyoncu, who also works with addiction. And we were chit chatting, and I asked him, aren't you planning to write a book now? You're getting close to retirement, etc. And he said that the book that he would have written is already written by someone else, and he named your book.
Oh, wow.
Yeah,
Honor.
so I was like, okay, I should dig deep into this book, and that's how I heard your name in like last year. And it's been. Can I just briefly introduce you for our audiences, very, very briefly?
Yeah, yeah.
So, Dr. Anna Lembke is a professor of psychiatry at Stanford University and chief of the Stanford Addiction Medicine Dual Diagnosis Clinic. She is a renowned expert on neuroscience of addiction. She's the author of New York Times bestseller Dopamine Nation, which I already featured in my channel. And she was also featured in the documentary The Social Dilemma on Netflix. So, it's been 5 years since you've written the book, and it took the US by a storm. Have you had any thoughts changed from then to now? Is it something, or did something came from a new research or a new client, or something that you've been working on changed your mind? If you were to write this book again, what point would you approach differently?
Yeah, great question. Probably what I would emphasize a little bit more is that dopamine has many different roles in the brain depending upon where it's released and in what context. And I would probably try to clarify too a little bit more that dopamine is not just released in response to pleasurable stimuli, but really is kind of like our survival neurotransmitter.
Mhm.
It's released in response to any salient stimuli in the environment that our brain registers as important for survival. So that can include even threat stimuli or painful stimuli, or really, anything that's new or novel in the environment. And I think that's, I made this kind of pleasure pain balance to really
Yeah.
emphasize this opponent process mechanism, which is really important, and the whole concept of neuroadaptation and how the brain habituates over time. Dopamine response gets less and less sensitive to repeated exposure. But I think I would probably spend a little bit more time describing some of the newer research showing that it's really this kind of salience neurotransmitter that just sort of says, hey, time to wake up and pay attention because something really important is happening right now.
Thank you. I was just yesterday watching a new recent video from your conference in Korea, in South Korea, and I loved how you gave a disclosure about not getting paid by drug companies. I don't know if this is a common practice, but I thought it was so ethical that
Oh,
you
thank you. Yeah.
made that point. I really enjoyed that, just as a side note. And also your book has these like almost Eastern philosophical approaches to how to deal with pleasure and how to deal with anhedonia. Almost, I'm very interested in Eastern philosophies as well. So I thought that distinct approach was quite interesting as well. And in your book, you present intentionally seeking pain, like cold showers, exercise, fasting, as a solution to this anhedonia or dopamine imbalance, let's say. But do you think this is a form of control addiction, that we're turning dopamine in order to reduce dopamine? Are we replacing an old addiction with a more socially acceptable or a trendy one when we do these pain-seeking activities?
Yeah, it's a great question, and it's an important question because there's no doubt that anything that releases a lot of dopamine all at once, no matter how we get there, is vulnerable to the problem of these habit loops and addiction. Especially when you apply technology to things like exercise or ice cold water baths, so that we can now make it, more potent, more accessible, more bountiful, and really, turn anything into a drug. So I do think we need to be very wary of sort of over relying on any one kind of behavior, including things that are challenging or painful or hard, lest we become, lest we turn them into a drug and also become sort of overly dependent on them to micro control in the moment the way that we feel. Because ultimately, when you dig deep enough, addiction is about control. It's about what can I do in the moment to sort of be master of my mini universe and change the way I feel, which is very different from letting go, surrender, acceptance, these more spiritual paths where we recognize that whether it's pleasure or pain, it's finite, it comes and goes, and our pursuit of it, is ultimately ingraspable. Like eventually, no matter what we do, we be master of these experiences, which is difficult for us to accept because we like to be in control. On the other side, I would say for modern humans, I do think that it is a very important message that we live in this drugified world where we've now organized all of our experience around our next reward, which means that we're constantly bombarding our reward pathway with these reinforcers, large and small, from the moment we wake up in the morning to the moment we go to bed at night, from reaching for our phone, making our favorite cup of caffeinated beverage with exactly the type of milk that we like, exactly the way we like it, to our commute to work, listening to the music that we want and switching the stations when we don't like it anymore, or the perfect podcast, getting to work and interrupting our workflow with videos and texting and emails, all the way till the night with the shows we watch, the cupcakes we eat, the joints we smoke, the wine we drink. The point being that we're all doing this. We've really organized modern life around these constant rewards and reward seeking. And I think it's important for us to recognize that, because once we recognize that and try to stop doing that, paradoxically, we feel better. We look at our day, instead of trying to pursue these mini rewards, which take us out of the present moment, we can get into a different kind of flow state where we just try to become part of the passage of time. And these are deeply, deeply spiritual concepts, but the point being that this relentless pursuit of comfort, convenience, and pleasure actually leads to anhedonia, or the inability to experience any pleasure at all. And it's when we stop trying to pursue comfort, convenience, and pleasure that we can find a balance or a flow state that really brings a deeper kind of joy.
That's a great segue to my next question, because I'm interested in philosophy. I'm a philosophy teacher. I'm interested in philosophy, sociology, psychology, and addiction, which is your specialty, is such an interdisciplinary concept, interdisciplinary phenomenology or experience, let's say. Do you feel like neuroscience or psychiatry falls short of solving the questions about addiction or solving addiction? That maybe there needs to be some sort of spiritual addition, or more metaphysical, or maybe sociological, the more social side, because I've seen that you have a background in humanities as well. uh, do you feel like psychiatry, neuroscience, positive sciences fall short of understanding and treating addiction?
Absolutely. Yes. I mean, we will never plumb the depths of this complex phenomenon just by understanding, brain chemistry or neural networks. Addiction is by definition an interaction between a human being and the environment that we live in. For example, I've talked about the ways in which capitalism and our system, our system of capitalism, which works so well in so many ways for so many kinds of problems, especially related to like human pursuit, basically, is a terrible system when it comes, to dealing with addiction, because in the perfect capitalist system, we would all become addicts, right?
Mm-hmm.
I mean, that is the goal, to be, these sort of ultimate consumers and do nothing else. And I mean, I would argue that we're almost headed in that direction. So, absolutely, addiction is can't just be reduced down to these sort of brain mechanisms. I mean, nothing really can. I do think it's useful to have a fundamental understanding of brain mechanisms and use that knowledge and leverage that knowledge to understand why we do what we do, which is why I write about it in a metaphorical way in Dopamine Nation. But yes, it's all much more complex than that. And it absolutely has to do with cultural tropes, economic systems, what we value, and yes, existential, philosophical, spiritual questions as well about, what is my purpose? What do I understand about sort of the fundamental experience of a human being, and how I can separate my instinctual drives from some higher order mechanisms related to my purpose and mission in life. And those are all relate to addiction. And that's why I think it's such a fascinating field.
Yes, I think so as well. A kind of parallel question to this: have you, because I already made an extensive video on your book, I prepared some more meta questions for you. Have you ever lost faith in psychiatry as a way to cure a mental illness? Like, because there, as you just mentioned, there are so many systemic issues that drive people to addiction, depression, anxiety, what have you. And these are very big issues, like systems, neoliberalism, etc. But these are very powerful. And have you ever felt like you're just scratching the surface by treating one patient at a time, and then trying to adapt that to a system that's already toxic, maybe?
Yeah, I mean, certainly, I've had moments of disillusionment with psychiatry. I've seen how a dysfunctional healthcare infrastructure conspires to keep people sick instead of getting them better. And even on a kind of a sort of, again, a deeper philosophical or psycho-spiritual level, I think psychiatry is limited in what it can do to help people grapple with some of these core existential issues, especially since it's very inward focused and past focused, looking at past time rather than more outward and future oriented, which is why I think spiritual pathways are so important and are kind of shunned in a lot of aspects, or secularized, more recently secularized into
Yeah.
sort of newfangled versions of certain forms of psychotherapy, which maybe is a good thing because these are important practices that psychiatry as a discipline has neglected. So all that is true and real. But I would say I've never felt disillusioned on a level like, I don't feel purposeful in my role, even one patient at a time. I mean, I am so grateful to have the job that I have because it feels purposeful. And when I have the honor of talking with patients and they share their, the deepest issues of their lives for me, I just feel like I'm so lucky. Like this is the best job I could possibly imagine, that I get to be a witness to their journey and hopefully on some level help them, improve some aspect of their lives. And in doing that, I try to open this very tight box that is psychiatry and bring in this other forms of wisdom. But I'm also grateful to have the psychiatric tools, the medicines, which can be at times life-saving. I don't think we should, throw the baby out with the bathwater. I mean, I think there are many different forms of wisdom, and I think it's good to stay open to all those different forms, and the kinds of packages that they come in, as well as being alert to, the ways that all of these various schools of thought can do harm and go wrong if sort of misapplied or taken to some extreme.
Do you can you specify what kind of philosophies maybe you feel closer to, maybe in your personal life, not in your professional practice, or maybe some psychological, psychoanalytic approaches maybe that are not so, that are somehow shunned by positive disciplines?
Yeah. Well, I have a new book coming out in November.
What's it about?
It's called Radical Surrender, and the subtitle is Letting Go in a World Addicted to Control. And it's about addiction, but it's also more broadly about how I think psychospiritual concepts are so important to living a thriving life in this modern world, where we have exerted our will on reality to such an extreme that we've created these tiny little worlds where we have an enormous amount of control, but also experience a great deal of emptiness and nihilism, anxiety, despair, and boredom. And I think that's because we have overexerted our will, and thought that would get us where we want to go. But without that spiritual element, that element of mystery, that kind of surrendering our will over to a power greater than ourselves, I don't think we're going to find the kind of balance and wisdom that we really need. So that's what my book is about.
Wow, it sounds very exciting. Do you have a name yet for the book? Or?
Yeah, the book is called Radical Surrender.
Radical Surrender.
It really identifies this kind of outward pivot and this letting go of our will, kind of less mastery and more mystery, as a path that I think more of us need to follow. And I talk about the neuroscience of spiritual surrender and letting go. I use some experiences from my own life, but also that of my patients. So it's kind of like Dopamine Nation, this kind of interweaving. But yeah, I'll be curious to see, I hope people read it, and I'll be curious to see what they think about it.
Wow, it sounds very exciting. God is dead, and now we need to invent one. We are living in a too much secularized world. Maybe it's too secular for it.
Right. And too rigidly controlled, right? I mean, it's in our nature to want to minimize uncertainty. But again, I think we've done that to a point where we've created like this sort of sterile world of dead fact that makes people feel really untethered and alienated from their lived experience.
Yeah. Even in dating, we want to control everything. Like we want to micromanage everything. Even in human relationships.
Yeah, we want to optimize everything. It's got to be
Mhm.
just perfect. We have to know exactly what's going to happen before it happens. Yeah.
Exactly. I think this is particularly an American thing because I'm a Turkish person, and I mean America is such a big powerhouse, and it also exports the cultural hegemony. So it's
Right.
here as well. But in Turkey, it's more like people tend to be more spiritual, like kısmet. Things happen for a reason. So there are always these, even in the most secular person, there are always these underlying beliefs that things happen for a reason. I don't
Love
have
it.
to.
Love
Yeah.
it. Yeah, and
So
don't you know
I
that
think
brings.
that's particularly a very acute problem in the United States, maybe.
I agree with you. And what I think that specifically tracks with, and I talk about this in my book, that as countries become wealthier and have fewer kind of both natural or other disasters to contend with, they become more secular, less
Mhm.
and less spiritual. So I think you're absolutely right. The history of the United States is such that we're such a dominant force.
Mhm.
Our borders are secure. We really don't experience any kind of imminent threat.
Threat.
And as a result, we think that we're the masters of the universe. Whereas countries, it's very clear that when countries experience threat to their borders or wars or natural disasters, people become more spiritual and religious.
Mhm. Yeah, future is never certain, so you kind of let go of trying to control it. Yeah, it's very blurry, so you get used to it.
You're humbled is the bottom line. You recognize that although there are a lot of things we can control, there are a lot of things that we obviously can't control. But if you live in a place like the United States, it's very easy to adopt the false illusion that we can control everything. And that seems like optimal, but it's actually ultimately makes people miserable. And so that's kind of what I
Mhm.
talk about.
Wow, it sounds very exciting. I can't wait to read it.
Thank
Congratulations.
you. Thank you.
Okay, my final question. This might be a bit divisive, but my our psychiatrist friend wanted me to ask you this. Um, what do you think about the legalization of hard drugs and soft drugs?
One of the biggest risk factors for addiction is simple access to our drug of choice. And so
Mhm.
it's very clear that when you have a given region where drugs are legalized, they become more accessible. When they become more accessible, more people use them. And when more people use them, that subset of individuals who is vulnerable to addiction is harmed. So, in general, I think that the US opioid epidemic and many other examples that I could cite in history have shown us again and again that we need to have barriers or borders between ourselves and our drug of choice. And the latest drug of choice is digital media, right? Which is 24/7 access on our phones everywhere we are, including for very young children. And now we're beginning to see the accumulated harms of 24/7 access to digital drugs, which is why thankfully people are beginning to recognize, hey, maybe we shouldn't give every kid, an iPad in school, and maybe we shouldn't give every person or every kid, especially, their own personal smartphone device. Maybe we should exclude those from schools so kids, aren't constantly walking around with a slot machine in their pocket. So I really feel that there's an overwhelming amount of evidence that legalization in general harms the most vulnerable, and that we need these kinds of barriers.
Okay, thank you so much, Dr. Lemke. It was a pleasure to speak to you. Also, I would just a small ask from you. I'm gonna end the recording now, but you need to stay here for a couple of minutes for the video to upload. Thank you so much again. I'm so grateful that you accepted my invitation, and I'm speaking for your Turkish fans that they're so grateful to have you on the show.
Well, thank you for your gratitude and your interest and your upbeat demeanor and positive attitude and great questions. So I'm glad I could do it.
Thank you. You're so kind. Okay, I'm gonna end the recording.